Good afternoon. Welcome to the daily briefing at the St. Clair County EMA office, where I'm joined with the chairman, Mark Kern, and also director of the St. Clair County Health Department, Barb Holt. Barb, the roller coaster continues, and we've got to do something about these numbers.
Absolutely.
We keep talking about it.
Absolutely. The numbers have gone up again. A roller coaster ride that we really don't care for. Today, we have 78 new positive COVID cases in St. Clair County. Of these, they're both males and females. We have several under the age of 10, all the way up to 90 years of age. This is, we had a total of 1,095 tests done. Therefore, we have total to date, we've tested in St. Clair County 47,900. Positive total of 4,662. Negative 43,238. Unfortunately, we do report one COVID-related death today of a male in his 60s with unknown health conditions. So we truly send out our sympathy in regards to the family and friends of that individual. Those that have completed the IDPH required 10-day isolation period, we're up to 3,857 folks. So today, with these numbers for St. Clair County, our daily positivity rate is at 7.1. For the state totals, they're again seeing increases there. They had an increase of 1,834 positive cases, and a total of 24 deaths in the state of Illinois. Again, these continue to go up. I don't have the date, the age range for these 24 statewide deaths, but again, one death is too many, so that raises a state death rate to 7,696 folks that have died due to some COVID-related illness. Today, the hospitalization numbers stay about steady in St. Clair County. We have 44 COVID-related patients in the hospital, but we do have one patient on the ventilator. So our prayers go to all those folks for a quick recovery. As far as congregate settings in St. Clair County, Cambridge House in O'Fallon has been added to the outbreak list. To be an outbreak, you have to have 2 or more cases, and that can be in your staff or in your folks that live there. So they have 2 cases and no deaths at Cambridge House in O'Fallon. Caseyville Nursing and Rehab, they have a total of 23 cases, with 7 of those 7 are additional just from today being reported. And also Mercy Rehab and Care Center in Swansea, they have 1 new case for a total of 6 cases, but no deaths. Countywide, today we just finished up testing at the Muscuda in Chevy Park, where last count we had over 200 folks that we tested there. We'll have more definitive information on that later. Those test results, again, folks, please don't call us. We'll call you. Our phones are very, very busy. As soon as we get those test results, we will call you as soon as we get them. But our phone's been very, very busy with all our contact tracing and a lot of general questions from the public. So we will call you. Don't expect those before at least 3 to 4 days after the testing is done. Give the lab a chance to get them tested. So please wait. Please be patient, and we will call you. Also today, Department of Public Health released an FAQ, a frequently asked questions guidance document for schools. This was just released. This is hot off the presses. It's under review. We have sent this out through the Susan Sarfaty's office and ROE to all the school superintendents. So again, it helps define more information on how to deal with schools that are open, that may be dealing with staff or employees or students that may be COVID positive or has symptoms. So again, a lot more details in this that we will be following up on. And finally, next week we will have more testing in St. Clair County. On Monday, we will be in Shiloh, downtown Shiloh at their community park, and these are all drive-through testing sites next week. They're from 8 a.m. to 4 p.m. You stay in your car. It's a drive-through. It's a nasal swab, and so Shiloh will be there 8 to 4 at the community park on Monday. Tuesday, we'll be at the Belleville West High School, and when you come to the high school, please come to the second entrance on the south end and enter there, and then you'll come back to the back of the parking lot, and then we'll have directions for you there to get to this drive-through testing site, and then the exit will be at the lights to help traffic control and it'll be a little safer there. And that is also 8 to 4 on Tuesday. Then on Friday, we'll be at Moody Park in Fairview Heights. Again, this is a drive-through from 8 to 4, and all this information is on the EMA website as well as our health department website. Okay, Chairman Kern, how are you today, sir?
I'm okay, Barb.
Good.
So when we look at the numbers, well over half today under 40 years old, and about a third are 20 to 29 years old. So we seem to be getting younger with our positives all the time. We've got to get the word out to the younger set that they're just as likely to get COVID as anybody.
Absolutely, and next week, I failed to mention, I'll be also speaking with the Chamber of Commerce, reaching out to our businesses, just imploring and pleading with them to help us all get together and enforce the mask wearing for their employees, as well as the folks that are visiting them, to protect themselves and protect their customers as well. So we're trying to get the word out with everyone. We're sending things out on our Twitter and Facebook account to reach that population that is they're just as vulnerable, and we're seeing the numbers rise every day.
And it's just good business to protect their customers, and certainly it helps protect them from lawsuits, which are always out there, something that business always has to worry about. We want those businesses to be open. We just want them to require the masks.
Absolutely. No one wants to step backwards. We want to continue going forward with this, and as we've said, and Herb said, and you have said all along, it takes a community effort, so we're reaching out to everyone to please help us in abiding by these rules, and this is the best medicine we have right now. So please wear your mask and do the social distancing.
And in our county positivity rate, so today was 7.1%, yesterday 5.9%. Last month we averaged a little bit over 10%, so we seem to be continuing to head in that right direction. And so we got also that, what we know from that is that a lot of people are washing their hands and they're wearing their masks and they're watching their distance.
Absolutely, and we need to keep it that way. Again, from months past, we've been from 20% to 10% to 7%. We're really trying to help get it there, but we are looked at on a regional level as well, because disease doesn't stop at county lines or state border lines, and I know regional-wise we've been creeping up there a little bit. So everybody's got to do this to be able to succeed.
Great. Thank you, Barb.
You bet, sir. Thank you.
It also doesn't stop at zip code lines, and so that's why we read the zip codes, so you know exactly where you are in relation to the rest of the county. All these numbers are COVID positive diagnoses that are in these particular zip codes in St. Clair County, and remember, these are cumulative numbers we've been keeping track of since probably April. So in 62059, we remain today at 10. 62201 goes up by 4 to 197. 62203 goes up by 1 to 164. 62204 stays the same today at 121. 62205 goes up by 1 to 168. 62206 goes up by 4 to 367. 62207 goes up by 1 today to 215. 62208 goes up by 3 to 296. 62220 goes up by 3 to 376. 62221 goes up by 15 today to 426. 62223 goes up by 7 to 229. 62225 stays the same at 19. 62226 goes up by 3 to 478. 62232 goes up by 5 to 104. 62239 stays the same at 56. And 62240 stays the same at 19. 62243 goes up by 2 to 36. 62254 goes up by 1 to 137. 62255 stays the same at 13. 62257 stays the same at 25. 62258 stays the same at 77. 62260 goes up by 2 today to 73. 62264 stays the same at 71. 62269 goes up by 5 today to 341, and 62285 remains the same at 47. So a long-time guest that we've had on the program is back today. We're glad to welcome Dana Rosenzweig, the head of St. Clair County Mental Health, to our program. Dana, thanks for being here today.
Thanks for having me, Mark.
So as we run through the numbers, the one thing that remains consistent is a need for help with mental health in the county. And so I guess let's run the gamut today. Let's start off with the younger part of the county, the kids, school. What's going on with the children? Are they susceptible to issues? I had a grandparent who was raising a 4-year-old tell me that the 4-year-old wanted to go to school. They missed their friends, and she was beside herself because she had to keep the child in, and she said, I'm no good at playing with a 4-year-old, and so I can't have friends over, and it's really been hard on her, and the child cries every night. Tell us about issues like that. What can be done?
Yeah. I think that we're just starting to see what some of the longer term effects are going to be, especially with regard to the social isolation of children, not having access to their peers, to play groups, those kinds of things. The one thing that we can take a look at right now, though, is the reaction that parents have, because children model a lot of their reactions to what their parents experience. We know that so it's like anecdotal information on children right now. We're just assuming what's going to be going on with them. But for adults, we know that fear, stress, and anxiety are 3 of the more common emotional reactions. And so those are healthy, those are normal reactions. However, we also know that for some adults, depression, drug use can pop up as well. And those can have the effect on children can manifest itself in possible child abuse. You can have stunted emotional development that's going to affect them as adults. So there are some concerns about what the long-term consequences are going to be on children.
So how do we access help for those issues and help you decipher exactly what's going on if there is an issue with the child or whether it's an issue with yourself?
Yeah.
How do you access service?
Well, what we've seen is that from pre-pandemic in February, our current service levels and volumes are down about 60 to 70%. And that's problematic because that means that children aren't receiving mental health services. And I'll elaborate on that a little bit more. Initially, schools closed, agencies closed, there wasn't access to those services. Criminal justice systems were closed down, and so those normal referral routes where kids would get referred to the system. For example, in St. Clair County, the majority of mental health services are delivered in school settings. Counselors go into schools, so you can imagine what the predicament is now that they don't have that access. The good news is some of those levels have been increasing a little bit. Without the schools, we've had more referral routes. Criminal justice is opening up somewhat, so that's been good. And the agencies remain in place through funding from the federal government, from the county. They retain capacity. They have staff. They're transitioning some services to in-person on a limited basis. And so we're seeing an improvement there.
Are there online alternatives available also?
With the recent developments of the schools going virtual, that has left the agencies scrambling somewhat, because the original plan was going to be is that the schools were going to provide rooms on campus where children could go and they would receive virtual counseling through the agencies. And so that was the plan that had been worked out for the most part. And that was a pretty good plan. They'd still have access. But what's happened now with virtual learning, that eliminates that as an option. And so what we're left to try to figure out now is how do we get services to children where they live? And that's going to be somewhat problematic, because the privacy of having a counseling session without a parent there could be a problem. Just taking away from the virtual learning of the day and getting a 30-minute counseling session in, just logistically there could be some issues with that. So I think right now people are trying to figure that out. The good news is that our agencies problem solve well. They are working with the school social workers, principals, and superintendents to now figure out how to do this, and they're very positive that they can come up with a plan. They also want to educate teachers on how they interact with parents regarding children's mental health needs. You know, how do you talk to kids about mental health? What are some common stress reactions? And so we're starting to mobilize the system to respond to the fact that we may be in a virtual education setting for a little bit longer.
So if a parent sees issues with their child or with children they know, the schools are the best conduit to be able to reach mental health services, or should they call you, or how do they access those services?
We'd probably like for them to engage as many sources of help as possible. So, and in some situations, in some schools, we know that the linkage from school to the agencies is better than others. So what I'd encourage them to do is to cover all routes. You know, let the school know. Also contact my office. I can give them referral information at 277-6022. The two mental health agencies in the county are currently doing intake. Chestnut Health Systems here in Belleville, Comprehensive Behavioral Health in East St. Louis, child welfare agencies who do mental health, Caritas, Hoyleton, Chassis, are all ramping up their services. So if parents contact us, we can get them in the right place. I just don't want parents to be at a loss in terms of not knowing what to do.
So COVID has been a perfect environment for anxiety and depression, and that leads to substance abuse for adults. But let's talk a little about substance abuse and what's available to help people if they're kind of spinning out of control. They see themselves headed that way. What can they do?
Well, first of all, I do agree with you. We've seen an increased incidence, and one of the issues that's actually happened with substance use services is they've not slowed significantly. That there's been a demand, and they've had a different engagement through virtual services, through medication that's delivered to people. So the demand for substance use services hasn't decreased at all through the pandemic. But what we're seeing is that there's an increase, as you referenced, in use, and we're seeing a resulting fatality as a result of some of that increased use. So we do have a system in place where services remain available through Chestnut, through Comprehensive, through Gateway, that people can access services, and we certainly want to encourage them to do that.
So we've seen an increase in overdose numbers, or you may not have access to that. I'm throwing that question at you without...
Well, actually, as of this afternoon, I do have access to that information. The coroner is very cooperative with providing that information on both on all deaths, and in our instance, we're interested in suicides and drug overdose. And Tina, the office manager, got back with me today and provided the information through June 30th. And it's significant with regard to substance use because in 2019, through 6 months of the year, we had 37 deaths. In 2020, through June 30th, we have 61 deaths. And so that's a significant, obviously, an increase. That has started early in the year and has continued. I wouldn't presuppose as to all of the reasons for that, although I know that the use of fentanyl continues to be very high, which is more lethal. Also, you have situations where people had difficulty accessing drugs or able to acquire drugs, then their tolerance was down, and then they have a fatal reaction to using drugs after a time of being away from them. And I think it's something that the drug use experts are going to continue to examine and try to combat.
So is there a hotline number for substance abuse that you would recommend, or they get a hold of Chestnut, or once again, your general number?
My general number would work. I would also encourage them to call Chestnut at 397-0900. I usually say 0900, that makes it sound better. But yes, and they will get someone in services within 3 or 4 days. So that remains, and they're doing some in-person, and they actually found that there were some women in treatment who preferred some in-person groups, and with appropriate social distancing and masks, they've just started that this week.
Great. So With the relative amount of new things that are coming, how about training? Are you having to keep up? Have your the people that you work with, are they having to kind of re-up their skills during this?
Boy, they are. I think with all of us, and starting with telemedicine, just needing to be able to upgrade your skills and to decide how you're going to deliver services, in this instance training virtually, has been a challenge. And we do have a conference, the annual When Mental Health Hits Home, that the board co-hosts with the Shrine. And that conference is going to be August 28th. And I keep mistakenly saying at the Shrine, well, it's virtually. So the speaker will actually be Dr. Carrie Wolf, who is the chair of psychiatry from SIU School of Medicine from Springfield. So she'll be joining us from Springfield, but that's a good conference because it's designed for lay people who are experiencing or journeying with someone who's experiencing mental illness. So they talk about issues such as accessing care, dealing with stigma, and those kinds of things. And it's been a conference that in the past we've had several hundred people on site at the Shrine. For this conference, we've had people register as far away as Texas right now.
Wow.
So that's been kind of one neat thing about the virtual platform, is that we're accessing some people that we normally wouldn't have had the opportunity to do so.
So can anyone register for this, and is there a cost?
There is a cost of $10 for the conference for professionals. There are CEUs available as well. There are also sponsorships available that if someone cannot pay that $10, we'll get them signed up without that. They would register by going to my website, which is stc708.org, and there's a registration link there for that conference. The other conference the training I wanted to comment on is we've shifted into suicide prevention training done virtually on a monthly basis. Actually, last month we had two. Diana Cuddyback, who you know, the director of HeartLinks, has been very helpful in that regard, and she'll be presenting next Thursday at 6 p.m. Question, persuade, and refer. We have been averaging almost 40 persons per session, and that's been a very successful training, again, intended for the lay public, in terms of being able to intervene with someone should they verbalize thoughts of hurting themselves. And again, you can register for that at my website as well.
Great. Anything else, Dana? Give us some closing thoughts. A little bit of positive probably would help right now.
I think we remain extremely resilient. We're seeing that as of our agencies as they convert to virtual platforms. I think the positivity is highlighted by a number of them who are figuring out new ways of serving families, of supporting our consumers. So instead of being downtrodden with regard to being pessimistic about the plight of where things are, I think those in the helping profession and those we have in St. Clair County have really risen to meet this challenge, and they're figuring out how we take better care of our most vulnerable population. Those are people with mental illness, people with intellectual developmental disabilities, and people with substance use disorders. So as a group, I'm very proud of the collective response that we've had as a system.
Great. Well, I'm proud that you're part of Team St. Clair. Thank you, Dana.
I'm always glad to come off the bench for Team St. Clair. Thank you.
Great. We'll bring you back out. Don't keep warmed up. We're
Okay.
going to need you. Herb?
Well, I'm not the guy you should look over here, and you just asked Dana to say something positive.
I know. That's why I had to balance out what's coming from you.
But Dana, don't go nowhere because I may need your services. If I keep reading some of these statements on here, and believe me, Team St. Clair, I love every one of you, and those of you who are supporting the cause, being a part of the solution and not the problem. But and as we say all the time, we know we're not going to get through everybody because they have their own agendas, they have their own beliefs. One person on here says, which is why there should have been no recommendations from the health department and left it up to the schools. Well, correct me if I'm wrong, but every school that we brought in here, one of the first things they told us said, we reached out to the health department. So if they reached out to the health department, they were looking for answers. And the health department said, we are making a recommendation, but if you get your plan together that meets the state requirement, you can do as you choose. So for those of you who want to be negative and blame the health department, blame somebody else, because the health department is working 24 hours a day to make sure you, me, our loved ones are safe. So that dog's not hunting here today.
And I think all but 4 of the school districts are are really engaging in remote learning for at least the first quarter.
Sure, and again, they've had their choices. They had to balance that. What was best for our children, what was best for their staff, and there's nothing 100% guarantee. But I just don't want the wrong people being blamed, because there is nobody to blame except for those who aren't wearing a mask, washing their hands, and watching social distancing. Blame yourself, even if you don't believe it. Take one for the team. Let's get this thing behind us. Look at St. Louis. They announced yesterday they're tightening up on some of their restrictions. They're reimposing additional restrictions for bars, restaurants, and nightclubs, limiting to the capacity of 50% and closing them at 11 o'clock. So it's just not here in Illinois that we're trying to tighten things up. It's global. If you're watching any of the news, whether you like it or not, it's everywhere. It's just not here. We're trying to do what's best for all of us.
And the regional positivity is going up. St. Clair County has significant numbers, but we are seeing all the counties that surround us now hitting that 8% and going above that level. That's why today we were at 7.9%.
And that's pretty close to 8.
That's in my book, that's way too close to 8.
I won't sleep tonight, because if I have to call you tomorrow and say we're at 8, it's going to be, of course, that's a 3-day consecutive that we have to be at that. So we're not there yet, but one day is too many. So that Team St. Clair, you're doing a great job of trying to get the word out, but please continue. Don't be set aside by the naysayers. Let them have their own thoughts. They're going to do it. So just continue to share the information. If you go someplace that business that isn't following what the recommendations are, go someplace else. We want you to support local businesses, but we had about 4 phone calls today of different businesses that's been on the list, and we've notified them and said, hey, we've got these complaints. Please comply, because it's about being compliant. Even though there is enforcement procedures, and now the health department has sent out letters. If I was a business owner, I would tell my staff, follow the orders, and when the customers come in, it's for your safety and my workers' safety, and that's simple. Tomorrow we're going to have a special guest on who has been a COVID patient, him and his wife. They'll be on here telling their story about how it went through them, because we get some people on here that says, oh, you don't know, nobody that's went through. Well, I think we've had 2 or 3 citizens in the county here and one from Madison County that has come on and told their story, and each time you hear them, we always get people saying, ooh, we didn't realize that. So tomorrow I'll join in at 3:30 and hear another person's experience with COVID-19, him and his wife. We're looking forward to that. And then we'll be back shortly with Cindy and Daisy to translate this into the Spanish communities, and we'll be back tomorrow afternoon around 3:30 with the next briefing. Thank you.